Hello everyone and welcome to you Dr. Ahmed Thabet. My name is عائد Abu Najim, a student at the Faculty of Agriculture and Veterinary Medicine at Al Azhar University, Gaza. Actually, today we'll talk about sporotrichosis, which is an infectious disease in animals. Let's go. This is the content of the presentation. I will briefly tell you about the disease, transmission, symptoms, treatment options, prevention, and others. Please look with me to this picture for horse infected with sporotrichosis. Thank you. About sporotrichosis. Firstly, sporotrichosis it is a non-contagious chronic infectious disease of equine, human, and other domestic animals, usually caused by Sporotrichs shinkai and characterized by cutaneous nodules and ulcers on the limb. Of course, infectious usually result from direct inoculation of the organism into skin wounds, and it is a dimorphic fungus. Okay, transmissions and epidemiology. Firstly, mode of transmissions. The pus discharge from the lesions of the infected animals is the main source of contamination of breeding, grooming, and other fomites. And we can find this disease worldwide occur most often in horses, but cases have also been seen in various wild animals like cats, dogs, including foxes actually. Here is a quick note about the predisposing factors like wounds and muddy stubble. Yes. Okay. There are many clinical signs including the continuous forms localized to the site of inoculation, although lesions may be multicentric. Yes. Also, the initial small nodules enlarge and become pustular and ulcerate. Yes. In this slide, we can see some diagnostic methods to help identify the disease, such as laboratory diagnosis, samples, and laboratory examination. And I would like to focus of isolation of organism. This is the best choice for a veterinarian. You can see this photo. Yes, thank you. Okay, this disease may be misdiagnosed clinically with a lot of disease like glandular. You can see in this photo a horse suffer from glandular disease. And of course, there is a lot of disease other than glandular, like cutaneous leishmaniasis. Yes. Okay, let's talk about treatment options. Of course, there are some treatment options, including systemic treatment, we can use the iodides or melfluoran, and we must pay attention to side effects during the treatment period because maybe the dose of iodides stopped or reduced if signs of iodism appear. And related with treatment options, we can do a surgical for infected animals. Yes, prevention and control. One of the best ways to prevent this disease is a prevent wounds and keep animals away from corrals. Briefly, best ways to prevent this disease is a prevent wounds and cleaning or continuous sterilization and isolation of infected animals. Yes. Finally, this some photo for some cases infected of sporochorisis like the cat and horses. You can see clinical signs and how the skin damaged by disease. Okay. Thank you all. Thank you, Dr. Ahmed Thabet, and goodbye.